So, Senator Becker, file item number 4, SB 1419.
Thank you, Mr. Chair. Members, one of the most sacrosanct relationships in our society is between a patient and their physician. In such a relationship, patients can consult their physician on private matters about their health and receive a free flow of information and high-quality care tailored to their needs. However, the sharing of patient health information without sufficient physician consultation and privacy protections can have a detrimental effect. And this can happen because federal information blocking rules require physicians and other providers to release patient data as soon as it's available. Thankfully, the federal rule defers to state law, allowing California the opportunity to balance the goal of providing patients access to information while protecting their privacy and adhering to their wishes. So what this bill does is it adds new patient protections into California law that will ensure patients receive challenging health information in the time and manner that works best for them. It also adds new protections for the most sensitive data so that patient privacy is maintained at all times. It also requires health plans to make patient data available through APIs so patients can have more control over their data. The bill is sponsored by the California Medical Association and has received no registered opposition. I respectfully urge an aye vote. Speaking in support of this bill would be Dr. Shannon Udovic-Constant.
Dr. Udovic-Constant?
In the white robe.
My name is Dr. Shannon Udovic-Constant, and I am a member of the California Medical Association Executive Committee. I've been practicing in San Francisco as a pediatrician for over 20 years, and I'm here today to testify in support of Senate Bill 1419, and I'd like to thank Senator Becker for bringing this bill forward. Senate Bill 1419 was introduced in response to federal regulations that have given patients unprecedented access to their own health information. The intent of this regulation is a very good one, in that it allows patients and their families to be active participants in coordinating their own care. But the rule has also serious unintended consequences, especially in my field of pediatrics. Clinical notes, which patients now have a right to see, often contain sensitive information that the patient might not want shared, such as teen mental and reproductive health history. This puts me as a physician in the untenable position of honoring my patient's wishes to protect their information or complying with the letter of the federal regulation. Thankfully, the federal regulation defers to state law, allowing us to resolve this issue. Senate Bill 1419 clarifies that I and my colleagues have the right to protect my patient's information when they so choose, and so I ask for your support today. Thank you.
Thank you, Doctor. And Mr. David Ford, if you're present.
He's available for technical questions.
All right. Just one quick comment in terms of there may be some confusion because of cross-referencing in this bill to other provisions. So I would ask you, Senator Becker, to take a look, work with our staff to make sure that there are no unintended consequences in terms of already existing law and how that may impact already existing law. So in the room, opposition in the room. Yes.
I would like to give 2 minutes testimony. I know there was an opposition.
Go ahead.
Senator Becker, we did not put, sorry, let me start. My name is Christina Hildebrand from A Voice for Choice Advocacy. We did not put in a letter of opposition because we were only recently made aware of this bill. I think one of the key things is that we support privacy, we support informed consent and transparency, but what isn't made clear by Senator Becker is that many of these sections of the code that it is addressing is when a 12-plus-year-old minor is giving consent to a broad range of treatments, and in this case, the parents would not have access to any of those records. We want children to be empowered. We want to ensure, however, that children have a strong relationship and a strong support system with their healthcare provider and therapists, but also with their parents and their guardians. That is really important on many of these issues, such as communicable diseases, the prevention of STDs, drug and alcohol problems, mental health treatment. All of those with this bill would not allow the parents to see any medical records if the minor consented to those treatments. We would like to work with with Senator Becker. We look forward to working with him to create something that is more of an opt-in, that allows children who do consent to those to have the conversation with their pediatrician, with their provider, with their therapist, that would allow them to choose whether their records are shared with their parents, or but not have this sort of blanket removal of medical record sharing with their parents. Thank you.
Thank you. All right, let's bring it back to committee. Questions, comments? Yes, Senator Borges.
Thank you, Chair. Maybe just a point of clarification. So when a minor has a relationship with a provider, does the privity with the insurance policy rest with the parents, or is it separate between the patient and the physician? Maybe it's, I don't necessarily need to put you on the spot. Maybe if anybody can answer that.
Yeah, so I'd actually ask my witness to comment, because also on the other piece, I think the concerns that have been raised is mostly really are already existing law. We're just adding clinical notes. But if I could ask, Dr.
Thank you. It's a great question. So just to clarify, this is pointing to state law that's already in existence around sensitive services for minors, and it's very narrow in terms of what's protected in that. And the intent of this is not, I'll get to your question about insurance. The intent around this is not to exclude parents from the care of their children. Parents are incredibly trusted and so important in the health of their children. And yet there's some sensitive services that if the youth is not guaranteed that there'll be some privacy, they won't disclose and discuss with me or anyone possibly. And that's really what the intent of this California state law, separate from this, was put into place for, was just to make sure that there's a place where they can ask a trusted adult who has a relationship in that family about some things that they may not feel comfortable discussing. And I always encourage that we bring that conversation back to the parents and often offer to help. And most of the time, those conversations do then return back into the child, and the parents. In terms of the insurance, what had happened when the sensitive services work got put in is that it got carved out from traditional insurance, and so Medi-Cal has protection around sensitive services so that there wouldn't be billing on the back end where you've allowed some confidentiality and then unintendedly disclosed through billing. And so that's the way the insurance piece has been handled with the existing law. And the other thing that I wanted to just clarify is that the technology has the ability to document all the information that's not under this sensitive services and release in open notes, and have this other sensitive information kept in a separate area. So only that would be blocked if the teen wanted it. So that opt-out actually the opt-in to the confidentiality from the teen is available in current technology of medical documentation.
Thank you.
Thank you.
I think this is one of those issues where you kind of scratch your head a little bit on, yes, you want individuals to seek and obtain medical treatment, as it's needed. And sometimes there are circumstances where, maybe a parent would disapprove. But I kind of hearken back to other issues that we've dealt with. What does it mean to be an adult? In California, we just run the gamut, man. I mean, you got to be 12 to get certain services. You got to be 17 or 18 to join the military, perhaps younger with parental consent. You got to be, 16 now to vote. Used to be 18 or something like that. 21 to drink alcohol. Like, we're just all over the place. So I guess the idea is, and I have two little boys. And I want to know that when they're getting services, and I don't know exactly the special services and the carve-outs, I think it's my responsibility to know. Just a father's perspective, I suppose.
Yeah, and I appreciate your thoughtful remarks, Senator Borges. I'd just say on this part of the bill, as our witness mentioned, that's really existing law. All we really are adding, this is kind of one piece of this bill, but it adds clinical notes to that part that's protected. So the other part is really already part of California law. So I think that's an important clarification, but we do think those clinical notes, I hear what you're saying, but we do think those clinical notes are important to protect as part of this. Yeah, I'll use that statement as my close. I appreciate all the comments and the voices were moved in. We do believe this is really important for that and will actually increase the patient physician relationship, and I respectfully ask for your aye vote.
Thank you, Senator Becker.